Autistic spectrum disorder. So, autism is a new developmental disorder characterized by qualitative impairments occurring in a child before the age of 36 months in three key areas: social interaction, often the earliest features of autistic spectrum disorder, also communication, interest, and activities. The clinical presentation is varied and may encompass children with severe manifestations of the features I mentioned, or with more subtle behavioral deficits, as a use of the term autistic spectrum disorder. So learning disability in this condition is very common, and the risk of epilepsy is significant. Autistic spectrum disorder is increasingly being recognized in several countries. The main causes are genetic or no clear etiology. The symptoms are absence of joint attention, that is failure to show interest, follow gaze, lack of social smiling, and limited use of gestures, for example, shaking head, waving, or clapping. The communication deficits, for example, receptive fails to acquire language or delay in understanding language, and also expressive. The communication deficit could be receptive or expressive. The expressive does delays in the use of language, and limited range of interest, and limited play with toys and other objects, and repetitive activities, for example, spinning objects, and global developmental delays, for example, walking, speech, among others, and learning difficulties, attention deficits, sleeping difficulties, feeding difficulties. The signs are lack of pointing to objects by 24 months, no single words in 18 months, no two words spontaneous phrase by 24 months, a loss of language, and avoidance of eye contact. The investigations usually none required, but encephalogram if seizures suspected, also brain CT or MRI only in special circumstances, for example, abnormal physical features present. So the main treatment objective is to correct social communication difficulties using multidisciplinary behavioral and educational approach. Non-pharmacological treatment, applied behavior analysis, that's teaching based on teacher request, prompt assistance to child response, and feedback. Pharmacological treatment for aggression, irritability, or self-mutilation. We give risperidone oral as in children 5 to 18 years. Body weight more than 50 kilograms, give 0.5 milligram daily. We may increase by 0.5 milligram on alternate days with a maximum of 1 milligram daily. On 5 to 18 years, the body weight less than 50 kilograms, give 0.25 to 0.5 milligram daily. We may increase by 0.25 milligram on alternate days, a maximum of 0.75 milligram daily, and less than 5 years is not recommended. For sleep problems, you give melatonin oral in children 1 month to 18 years, 2 to 3 milligrams daily before bedtime, and increase if necessary after 1 to 2 weeks to 4 to 6 milligrams daily before bedtime with a maximum of 10 milligrams. For significant hyperactivity in children 4 years and above, you give methylphenidate oral in children 6 to 18 years, 5 milligrams 12 to 24 hourly, and then you increase if necessary at weekly intervals by 5 to 10 milligrams, the maximum of 20 milligrams 8 hourly. In 4 to 6 years, you give 2.5 milligrams 12 hourly and then increase if necessary by 2.5 milligrams at weekly intervals, a maximum of 0.4 to 0.5 milligram per kilogram 8 hourly. Discontinue if there is no response after a month. Referral criteria: all suspected cases of autism should be referred to a tertiary center.